Congratulations. Welcome to the Sojourns community.
Thank you.
Tell us a little bit about where you're from and the project that you're working on.
Thank you. I'm honored to be here. So I actually work at the University of Vermont College of Medicine, and I'm working on a project telecoaching palliative care communication skills for rural health clinicians.
So important.
And I did most of my palliative care training and sort of early career as a attending in New York City, and never really experienced rural health. And then I came to Vermont and I started noticing that rural health patients actually are an important part of the United States and actually make up 20% of Americans. And in Vermont, it's actually 50%.
Yeah, and same in Oregon and the Northwest, we have a large.
And they 50% live in this Burlington area, and then the rest all live everywhere else. And I heard stories about patients not being able to access palliative care after discharging from the specialty hospital or hospice even. And most of their palliative care experience was from rural health providers who do primary care. And so this intervention is really to target those frontline providers who are doing most of that palliative care work and give them some education to bolster up their palliative care skills.
That's great. That's great.
And
So what will the training look like? What are the key components there?
So the first step is actually to take a workshop, and 8-hour communication skills workshop. So I'm starting with communication skills because it's probably the most ubiquitous skill in palliative medicine. I imagine this could
Probably in all of medicine.
all of medicine, exactly. It can be used in everything, right? And so starting with that, they'll take an 8-hour course. And then actually to help improve skills over time, we're actually gonna then coach them. But given they'll be at rural settings all across the state, we'll actually coach them through teleconferencing.
Nice.
It'll be about an hour every other week. They, as a cohort of 5 clinicians with one coach, will actually talk about their experiences, their roadblocks and obstacles and serious illness conversations, and then actually we'll get coaching from each other and from an expert.
That's great. How do you think about moving this project beyond Vermont? Since obviously there are a lot of rural communities and people living in rural communities throughout the United States.
Definitely. And so twofold, I'm going to learn from what Project ECHO has done across the country with hepatitis and chronic pain, and actually learn about that hub and spoke model to actually replicate that. Two, Vital Talk, which I'm fortunate to be part of, they're always wondering about what happens after people take their courses, but actually to apply that model to their own work as well, and hopefully spread the durable or changing skills after those courses.
Yeah, that's great. That's great. And then tell me about your mentor. Who's your mentor in this program, and how do you feel about the importance of having a mentor?
Yeah, so I definitely, through my early career, realized mentors are so important. They are your own coaches, and they coach on different skills. And so I have a group of really amazing mentors who are coaching me on different aspects of my project. So Tony Bach and Bob Arnold through Vital Talk.
Oh, such great people.
Totally, amazing work they've done, and really coaching on the content piece. And so how do we teach through the teleconference lens? And then Bob Gramling, who's done a lot of population health, he's based at the University of Vermont, to really think about how to measure impact, how to measure culture change. And actually one other doctor, who's Alan Ramsey, who served on the Green Mountain Care Board, which is Vermont's policy-making board for health. And he actually has a lot of experience about how the health system works in Vermont, and he will be a great mentor on the replication in Vermont and beyond.
You've really created a team of mentors. That's great. And then being part of this community, you obviously have access to the other classes of cohorts and also mentors at the national level. Talk about that and how you think it will impact your project.
Just actually being here for a day already, getting some great ideas from a lot of colleagues what obstacles they faced and getting some advice. And then even within my cohort, there's someone doing rural health, there's someone doing teletechnology. There's someone in business, and so just learning from them and actually helping to support each other and push each other, I think is going to be an important part of the success of this program.
Yeah, it's neat. Now that we have 52 scholars, there's quite a diversity of thought amongst the scholars and backgrounds and perspectives that people can really learn from each other and in a way that's really safe and outside your institution. That I just think that diversity of thought, diversity of practice enhances everybody's experience, I think.
No, I totally agree. It makes us
I think honestly,
better.
even just standing here right now, the way that I'm thinking about teaching in my own space is very different after having talked with you around this idea of like how you teach through the lens of a camera. Like that's a novel, interesting idea.
Yeah.
I'd love to learn more.
An amazing challenge, but hopefully something we can work together and accomplish. So.
Yeah.